We know that there's a lot of different endpoints that we can look at in clinical trials. In oncology trials, we tend to really concentrate on survival. Do patients do better? Can we get more patients into remission? Are we able to improve their outcomes? Really, within the last decade or so, we've also started to look at other important things, such as quality of life. Can these therapies that we're giving patients have an improvement in their survival, but also do that without compromising their quality of life and their functional status. So what we found is in our study, which was an ancillary data study that utilized data from GOG 218. GOG 218 is a landmark clinical trial that looked at adding bevacizumab to the backbone of paclitaxel and carboplatin, that we could, number one, group patients by their quality of life surveys. And again, these are instruments that the patients themselves fill out. So it's nothing that we do as providers looking at the patient, but the patient actually objectively reports how they're feeling, what their symptoms are. And we found that we could look at those reported outcomes from the patients and determine how they were doing. And we saw that if you started out and you weren't doing as well, the patients in the lowest quartile, that with treatment, if you got better, your outcomes tended to be better. And we also found that if your outcomes were better, or your functional status was better at the beginning, that as time went on, as long as you continued to do well, we would predict and we observed that you would do better. I think importantly though, and somewhat disappointingly, only about 60 or 65% of patients that potentially could have completed all the survey instruments did so. And so we are missing a fair amount of information that's there.